Hi, in this video we are continuing with the external features of spinal cord. There are four important external features in the exam point of view. Which are they? The coda equina, fissures and sulci, attachment of spinal nerves and enlargement. First of all, we are discussing the coda equina. Before going to coda equina, I am again repeating to demonstrate the conus medullaris and the phylum terminale. As we all know, the spinal cord is shorter than that of vertebral column. So the spinal nerves have to increase its length and emerge out through their respective intervertebral foramen. So nerves from the caudal part of spinal cord, that is from C1, it form a bunch of nerves around the phylum terminale like this. It resembles the tail of a horse. So it is called as coda equina. The second one is the spinal cord have an fissures and sulci. Which are they? Andromedian fissure, two androlateral sulci, posteromedian sulcus, two posterolateral sulci and two posterintermediate sulci. The spinal cord is divided into two halves by the andromedian fissure and the posteromedian sulcus, and each part is again divided by, that is each half is again divided by the androlateral sulci and posterolateral sulci into three regions or three columns. It can be discussed later in the next video. The third important external feature is the attachment of spinal nerves. The spinal cord gives rise to 31 pair of spinal nerves, each having a ventral root and a dorsal root. This is the ventral root and this is the dorsal root. The ventral root, it comes out through the androlateral sulcus, and the dorsal root, it comes out through the posterolateral sulcus. As there is 31 pair of spinal nerves, there is 31 pair of spinal segments. What is meant by spinal segment? Spinal segment is the part of spinal cord through which a pair of spinal nerves are emerging. There is 31 spinal segments. Which are they? 12 cervical, 8 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. We all know there is 33 vertebral segments. The spinal segments and the vertebral segments does not lie at the same level. The spinal segments are always at a higher level than that of its respective numerical vertebral segment. Why? We already said the reason. Because the vertebral column always grows faster than the spinal cord. So the spinal segments lies at a higher level. Then the fourth important external feature is the enlargement. What is meant by enlargement and how it is forming? Enlargements are greatly due to the increased number of motor neuron in the anterior horn cells of the spinal cord. We all know the spinal cord is not uniform in diameter. It presents two enlargements in those areas which supplies the upper limb and the lower limb. The cervical enlargement from C5 to T1, it forms the brachial plexus, and the lumbar enlargement from L2 to S3, it forms the lumbar plexus. Let us have a quick recap on the important points discussed so far. We already said the spinal cord is a part of central nervous system. As a continuation of what? Medulla oblongata. It extends from where to where? It extends from the upper part of the first cervical vertebra to the lower part of the first lumbar vertebra. How much is its length? 45 centimeter. And we have to know the other structures also having 45 centimeter. And in childhood or intrauterine life, it occupies almost the whole length of vertebral column till the third month of intrauterine life. In infants, its lower level ends at which level? L3, and in adults at L1. Then we must identify or know the meningeal coverings of the spinal cord. It have a outer dura mater, middle arachnoid and inner pia mater. And the modifications of pia mater, we know there is four important modifications. Among the four important modifications, the phylum terminale and the ligamentum denticulata have greater importance. Phylum terminale, it is the extension of pia mater from the tip of conus medullaris to the first coccygeal vertebra. It have two parts, phylum terminale internum and phylum terminale externum. Then the ligamentum denticulata. Ligamentum denticulata are the triangular lateral extensions. It is 21 in numbers, which passes between the ventral and the dorsal roots of the spinal cord, and it connects to the overlying dura mater. Then the important four external features of the spinal cord, which are they? The coda equina, the fissures and sulci, the attachment of spinal nerves, and the enlargement. How is the coda equina is forming for what? We all know the spinal cord is shorter than vertebral column, so the spinal nerves have to emerge out through their respective intervertebral foramen. So the nerves from the caudal part, it form a bunch of nerves around the phylum terminale like this and likes the tail of a horse. So it is called as coda equina. And the spinal cord have fissures and sulci, anteromedian fissure to anterolateral sulcus, posteromedian sulcus to posterolateral sulcus, and posterintermediate sulcus. Then the attachment of spinal nerves. The spinal cord give rise to 31 pairs of spinal nerves, each having a ventral root and a dorsal root. As there is 31 spinal nerves, there is 31 spinal segments. The spinal segments and vertebral segments does not lie at the same level. Then the fourth one is the enlargement. The spinal cord have two enlargement, and how this enlargement is forming? It is due to the greatly increased number of motor neurons in the anterior horn cells of the spinal cord. There is two enlargement, cervical enlargement and lumbar enlargement. Thank you.